so of course this is our front lobby and reception area, and we really tried to make it open and warm and inviting so that the patients feel more like that they're at home and, you know, not a scary hospital with needles and all kinds of bad stuff. So we really are trying to make it a pleasant experience. We do have a few unique things about our hospital that sets us aside from everywhere else in the area. One of those is the first room that we're going to have up here, and of course we're still getting things organized and set up and decorated, so the basics, but we're functional right now. This room here is actually called a comfort room, and the purpose of it is kind of one of the most unfortunate ones that I have to deal with, and that's when we have euthanasias. Basically this room serves the purpose that when we have clients who come in and for whatever reason they're having to make that decision, we can bring them in here. There's a love seat, we're going to have a braided rug, and it's just kind of a nice quiet place that, you know, they can spend that last, you know, moments with their pet. It's not in the exam room or on a, you know, cold sterile table. It's kind of nice, warm and comfy, and that way the owners can take as much time as they need. There's also a separate exit door, so when everything is done they're able to exit out through there and not have to go back up front where there's a waiting room full of people and, you know, they've just put to sleep their best friend for years. So it's just kind of a nice little private way of doing things, and it's called just a comfort room. So then also, as we come back into our treatment area, we do offer digital radiography. So when patients come in, they need x-rays, we can take them in here and we can actually have computerized digital images within 60 seconds. That way we can manipulate those images, we can email them to specialists for consultants. Everything is available literally at the touch of your mouse. So it's quite fast in emergency situations. We don't have to process film and dip it in tanks. It's literally immediately. So this is our treatment area, and so this is where we can do dentals, that kind of procedure, small procedures. This is also where we prep our surgery patients. Once surgery patients are prepped, then we actually offer a sterile surgery room, so they will go straight into surgery. And once the patients are in there, doors shut, very similar to the hospital, so there's no in and out traffic. Of course, the patients that we work with are very furry, so there's always, you know, hair and stuff floating around, and by doing that we don't have to worry as much about contaminants going into an open animal when we're in the middle of our surgery. So it just kind of helps to keep things a little bit more professional and sterile. These are our treatment cages, so this is where our surgery patients or sick animals are, so that they can pretty much be seen from anywhere in the hospital. Just makes it easier for monitoring and that kind of thing, so they're not just stuck back in a room and not watched. We offer a separate cat ward. So when we have cats that are here, they can go into their own little cat ward with the window, and so they're not in with barking dogs and nice and noisy, so they have their own little luxury suite over here. And then we have, of course, like I said, we're still getting things set up. So the drug room is here. We have employee bathroom. Our food shelves for all of our prescription diets will be going there. Our large animal facility is drive-through. So when we have clients that come in with the trailers, they will actually drive around, and we can unload the cattle. They'll come through the working facility. We have a sick or hospital pen there in the middle that we can cut animals out if they're going to the stockyard or they need special treatment. We can get those in, and then they just go right back on the trailer. So flows quite nicely. We have in the upstairs, we also have a nursery. I have a daughter who will be 5 months old on the 1st, so she's upstairs in her little domain. This is our isolation ward. So this is when we have rabies suspects or parvo cases or anything that is a possible contagious disease. They will go here in separate isolation, and it's at the back of the facility, so there's not as much traffic that goes through and that kind of thing, but it's still just nice and quiet. We have a large room for larger animals and then cages for the smaller. Our kennel area, they're still working on my runs, but we will have temperature control, For the runs, we have separate sizes. We've got 6x5 larger runs, and we've got some 5x4 that are smaller. We will have a fenced-in exercise area so that they can go out during the day. The other thing is that we have 24/7 video surveillance monitoring. So we have long office hours. We're in from 7 until 6, Monday through Friday, and Saturday from 7 until noon. But usually, after we leave at 6 o'clock, I usually try to come back in around 8 or so and check on everybody, walk one last time, put them to bed, that type of thing. But I can, from either my cell phone or a computer screen, I can check on any of my patients at any time from anywhere. So even though I may not physically be in the building, they're not alone. Makes it a little bit nicer. We have a grooming room. And we've got a large walk-in shower bay for the big dogs, and then we have the small tiled shower for the smaller kids. Our grooming table isn't here yet, it's ordered, so we're kind of making do out here. But this is our grooming room. We have a full lab facility, so if an animal comes in and needs blood work done, we can run the vast majority of those things in-house, and we get results within 13 to 14 minutes. And that's what these machines here are going to do for us. We also have our small animal pharmacy with medications up here. We have 2 exam rooms, a cat exam room and a dog exam room. So we try to keep them a little bit separate so we don't have a cat coming in and getting all stressed and freaked out because she smells the dog that was in there right before her. So it kind of helps anxiety levels to keep the species separate. If we need to, we can always cross over if we're super busy with one and not the other, but we do try to keep them separate. But that's kind of the rundown of the facility and some of the things that we have to offer.